Chromoendoscopy is based on the topical application of dyes during endoscopy with the objective of improving visualization, identification and characterization of the premalignant and malignant lesions. For specific lesions, directed staining is used, while for monitoring dysplasia in inflammatory bowel disease, pan-chromoendoscopy is recommended, with non-directed staining of the entire mucosa of the colon. Basically, two types of dyes are used. Methylene blue initially acts as a contrast dye and is then absorbed rapidly through the normal bowel mucosa. This process requires approximately 60 seconds. In the colon, no staining suggests dysplastic, neoplastic or inflammatory changes. Stable patterns are stable for more than 20 minutes. Washing after staining and suctioning the remaining dye is important for proper interpretation of the pattern. Indigo carmine contrasts, accentuates and highlights the small changes in the mucosa. Staining patterns, especially if combined with magnification, help to identify hyperplastic or neoplastic changes. Contrast stainings remain in the colon for a few minutes and then disappear. The most used application is the spray catheter. The catheter is inserted until it sticks out 2 or 3 centimeters from the tip of the colonoscope. The syringe is handled with constant and firm pressure, creating a narrow layer of dye while the endoscope is removed in a spiral motion. The stained mucosa is assessed in 20 to 30 centimeter sections. Once each section is stained, the excess dye is suctioned, and the colonoscope is reinserted up to the proximal area of the section to be tested. It is important to biopsy all mucosal abnormalities viewed with chromoendoscopy. For analyzing staining patterns, generally magnification is used, a technique that allows the size of the images to increase in real time. While the standard endoscopes allow a digital amplification of the image 30 or 35 times, the magnification endoscopes amplify it up to 150 times by optical zoom. The use of a transparent CAP stabilizes the focal distance between the lens and the tissue by 2 mm and improves the quality of the image. At present, there are 3 chromoendoscopy techniques performed without dyes, called virtual chromoendoscopy, although its use in monitoring inflammatory bowel disease has not proven to be better than conventional endoscopy. Narrow band imaging is based on the modification of broadband light emission. It uses filters that narrow the wavelength of the light to the blue and green spectrum, enabling visualization of the capillary pattern of the colonic lesions and its architectural modifications. This system is included in a conventional colonoscope, where the NBI option is selected by pressing a button. The FICE system and iScan system are based on the same physical principle, but they do not use optical filters, but digital image processes that intensify certain wavelengths for revealing details of the mucosal structure.